Hi, welcome back to our channel. I'm DM, your breast expert.
And I'm Valerie, your plastic surgery expert.
And today we're going to talk about something that a lot of women want, bigger boobs. So Valerie, do you want to talk to us about breast augmentation?
Yes, so every day in my office I do see women who are interested in having a breast augmentation. And as a matter of fact, if we look at the statistics for cosmetic procedures in the United States, breast augmentation is always in the top 5 and also probably always the top most popular cosmetic surgery performed. And why is that? It's because people are really satisfied with the outcome of the surgery. Having said that, I think it's very important for women to carefully choose their plastic surgeon. You want to be able to find someone who is really able to understand your concerns and your goals and expectations, and someone that you get along with. So, you can actually find a surgeon who has a personality that really fits with yours. So I really think that women should meet with a few surgeons before making their final decision, and also making sure that your surgeon is a plastic surgeon. Cosmetic and plastic surgery is extremely popular, and so every healthcare worker is trying to get into that business. So if you don't do your homework carefully, you may end up sitting in front of a family physician or a gynecologist or someone who is not a plastic surgeon who will still offer the procedure. And I think that you want to be with someone who is an expert in the field, and those are plastic surgeons.
So, I agree with you.
Mm-hmm. And I think another thing to look for is to look for a surgeon who is board certified with the American Board of Plastic Surgery. And again, you have to be really careful because in the United States there are boards of cosmetic surgery, and so people think that they're plastic surgeons, but they might not be. So you really have to look for the American Board of Plastic Surgery.
Yeah, and I think in Canada, the Royal College certified plastic surgeon are going to have the letter FRCSC after. Mm-hmm. So Valerie, so a patient now has decided to want to have a breast augmentation. What are the things that she can look for in order to choose her plastic surgeon?
Right. So in choosing a plastic surgeon, so I did mention earlier that you want to find someone who you fit with in terms of personality, but also you want to make sure of their expertise and their skill set. And so I think it's important to, ask questions to the surgeon. For example, how long have they been in practice? Are they American Board certified? But also, how many of these procedures have they performed? And they should also be able to show you photographs of their work. And ideally, you want them to show you pictures of someone who is in your age group with a breast shape and size that is similar to yours before surgery, so that you can have a pretty realistic picture of what things could look like afterwards.
So let's say now that I have chosen you as my plastic surgeon. What can I expect at my first consultation with you?
The first things you want to discuss with your surgeon is really to express what you are hoping to get from the breast augmentation surgery. So be really comfortable discussing your concerns with your current breast shape or size. You want to be able to also discuss your expectations. And then your surgeon will want to ask you several questions about your medical and surgical history. So past medical history, previous surgery you may have had. What is your personal or family history of breast cancer? Have you had a screening mammogram in the past, if you are in the age group to get a screening mammogram? Have you had past pregnancies, or are you planning future pregnancies? What is your smoking history? Things like this that may all be important in order to give you an idea of what type of outcome you can expect. Once the discussion is complete, then the surgeon will move on to your physical exam. So in the physical exam, your surgeon will want to do a breast exam, but also look at your chest, meaning your ribs, how are they positioned? And the goal here is to try to notice any asymmetry or differences in shape, size, in your breasts, and also on your chest wall. So your surgeon will take measurements and then also assess your armpit just to make sure that the exam is really complete. Once the exam is done, the surgeon will also take photographs. And in terms of the photographs, there are a lot of devices available on the market that your surgeon may have available in their office. For example, to be able to do a simulation of what your result will be like with different implant sizes that can be simulated on the photograph. I would say to that effect that I think if the surgeon doesn't have the tool in their office, you can still have a great outcome. Again, I think it comes down to finding someone with experience and someone that you really get along with and trust. So once the physical exam is done, the photographs are done, then if you decide to proceed with surgery, your surgeon will establish a personalized surgical plan for your breast augmentation. And so in the surgical plan, really, there are three main things that will be determined. First is the type of implant that will be used. So the two main options are saline or silicone. And then we will also want to decide where the incision will be located. So the incision can either be in the armpit, it can be at the breast crease underneath, it can also be around the areola. And there's another alternative, which is a little bit less popular, but still available, which is to go through the belly button for your breast augmentation. And some surgeons will prefer to offer just one of these incisions. Other surgeons are fine offering any type of incision that you may want if you have a certain preference. And again, this I think is important to discuss with your surgeon so you're comfortable with what they have to offer. And then the third thing that is important to decide in the surgical plan is where the implant will be located. So the implant can be placed in front of the muscle, so behind your breast tissue, but in front of the muscle. The second option is to place the implant behind the muscle. And the third option is to place the implant behind the fascia. So what is the fascia? The fascia is what I like to use the analogy of a saran wrap or like a plastic wrap. So it's very, very thin layer of tissue that surrounds all the muscles on your body. And so the implant can be placed behind that layer at the time of your surgery. So the implant is still in front of the muscle, but under that fascia. So these are the three locations where the implants can be placed. And again, if you look in the plastic surgery community, there are all kinds of discussions about preferences, and nobody really has a consensus on which one is the best. So again, you have to see what your surgeon has to say, what is your surgeon's experience with these different options so that you can make the decision that works the best for you.
Okay, so now that the patient has her plan in her hands, what happens on the day of the surgery? Can you take us through the whole procedure?
So the breast augmentation is a surgery that is usually performed under general anesthesia, and it is an outpatient surgery, so meaning that you can go home the same day. The surgery usually takes about an hour, rarely over an hour, and the surgeon will essentially execute the plan that you have agreed upon in the office. So make the incision where you have agreed to have the incision, and then dissect a pocket where you have agreed that the implant will be positioned. And the other thing I should have mentioned is that In selecting the breast implant before surgery, many surgeons, in addition, if they have the simulation software available in the office, they will offer that. But also, you want to try on implants, so you will have what we call a sizing appointment, where you will have the opportunity to try different sizes of breast implants, so that you can choose what you prefer. And so then the surgeon will place that implant in the pocket that has been agreed upon in the office, so behind the muscle, behind the fascia, or behind the breast tissue in front of the muscle, and then close the incision. So like I said earlier, it's usually a surgery that can be done under an hour, and oftentimes at the end of the surgery, your surgeon will inject a medication that can provide pain control for a few days after surgery and make the recovery a little bit easier.
In terms of recovery, what type or how long does the recovery last? Like what does the patient can expect?
So I always tell patients that the recovery depends on many things. It depends on the patient's pain tolerance, of course. It also depends on where the breast implant has been placed. So it's a very well-known fact that whenever a surgery manipulates muscle, so if the implant is placed behind the muscle, there will be more pain after the operation. Also, I think another thing to factor in the recovery is the patient's lifestyle, their level of activity, the type of job that they have. So for example, if my patient is a hairdresser, where they use their arms a lot, I may ask them to take a bit more time off work than someone who has a desk job and work on a computer, for example. So the recovery can be, as short as about a week to a few more weeks, again, depending on all these factors. And in terms of pain, I think it varies a lot from patient to patient. I have patients who will only take Tylenol, for example, after surgery, and they're fine with that, and others who need a stronger pain medication after surgery.
What types of risks and complications can a patient who has a breast augmentation expect?
So this is, of course, a really important part of the preoperative discussion. So I always like to divide the risks and complications into early postoperative complications and later postoperative complications. So if we look at the early postoperative complications, there are usually two main things which we repeat in almost all our videos: infection and bleeding. So both of these complications are exceedingly rare with breast augmentation. However, I think it's important to mention that if they do occur, it can be pretty devastating for the patients. So if there is a bleeding, you may have to go back to surgery to get the bleeding to stop. If there is an infection, and again, keeping in mind that this is exceedingly rare, but if there is an infection, patients may have to have their implant removed for a few months, and of course this can be extremely stressful and upsetting for patients. But thankfully, not often. This doesn't happen often. Now, if we focus our discussion on the longer-term complications, I think the two main things that we should talk about are implant rupture and also capsular contracture. So with regards to implant rupture, I think I always give my patients the wonderful analogy of comparing your breast implants to a tire on your car. We all know that tires are not good forever, and we know that we have to change them. And it's the same thing for your breast implants. They are not good forever. There is wear and tear on the implants, and you may have to change them at some point in your life. So most breast implant companies will say that the implants are good for 10 years, but this does not mean that at 10 years you have to have them changed. You change them only when there is a problem. So with regards to implant rupture, again, I think that this may or may not be noticeable depending on the type of implant that you have selected. So for example, if you have a saline breast implant, so the implant is filled with saline water, and if the implant does rupture, then you will have a flat breast on that side, and your body will simply reabsorb the saline water. In the case of silicone breast implants, it's a little bit different. So depending on the type of silicone in your implant, the rupture may or may not be noticeable. So over the years, the silicone in the implant has been changed and improved by the breast implant companies. So often I use the example of, maybe back in the 60s with the older generations of silicone, the silicone was more like honey, meaning in texture, meaning that if the implant ruptured, there would be silicone all over the breast. Nowadays, the silicone is more like a gummy bear. So meaning that if we cut the implant in half and look on the inside, it looks like a gummy bear. So that means that when a rupture occurs, the silicone will not leak outside of the implant like it did with the honey. But that also means that in a patient who has the gummy bear implant, a rupture may not be clinically visible, and in order to diagnose a rupture, you need usually to do an imaging test, and most frequently we will have to do an MRI. So those are the main things about the rupture. So in terms of the rupture, there is, usually it needs to be addressed with a surgery. It doesn't mean that, the moment you notice a rupture, the surgery has to be done in the middle of the night, but it needs to be addressed at some point, depending on your schedule and your level of distress with the asymmetry that may be noticeable. And so again, it would be done under general anesthesia where the old implant is removed. The capsule around the implant might be removed as well, and then if you decide that you want to have a new implant in, then it's done at the same time. So now if we move on to the topic of capsular contracture. So what is capsular contracture? So whenever a foreign body is placed in the body, whether it's a hip implant, a breast implant, a chemotherapy port, any of those things, because it's a foreign object, it's a normal reaction for your body to try to encapsulate that foreign object, meaning that your body will form a thin shell of tissue to try to separate the foreign body from your own body. And so this is a normal process for everyone with breast implants. The thing that will happen over time, and it's usually for the majority of women, a gradual process, is that capsule will slowly thicken and harden. And in women who have very old breast implants, you can even find calcium in that capsule, so it almost becomes like an eggshell if you want. And so what will happen is that as the capsule thickens and hardens, the breast will become firmer, which can lead in the most severe cases to pain and discomfort, which may prompt the patient to seek an additional surgery to try to address the problem. And the challenge is that once capsular contracture sets in, there is a good chance that it might recur in the future because, again, even if the old capsule is removed, your body will form a new one the minute a new breast implant is placed in. So, there's a lot of ongoing research about capsular contracture to try to, eliminate the problem in a perfect world. And right now the research mostly focuses on the fact that capsular contracture may be associated with a subclinical infection in the breast. What that means is that we all know we all have bacteria in the breast, and so if this bacteria comes in contact with the capsule, it may increase the risk of capsular contracture. And the other thing that is mostly discussed that can increase your risk of capsular contracture if there is any inflammation in the breast. So what causes inflammation in the breast? Things like bleeding. So for example, if after your breast augmentation you had some bleeding, it does cause more inflammation in the breast, and you may be at a higher risk for capsular contracture. Same thing if you have an infection. And that's why during surgery, your surgeon will be very meticulous in how the implant is handled, minimizing the contact of the implant to your skin, changing their gloves, and having a very meticulous surgical technique that will minimize your risk of capsular contracture in the future.
And is there any type of warning in terms of cosmetic results that you give to the patients before their surgery?
Right.
Because I imagine that sometimes the expectations can be very different from the results, or there are things that they might not expect unless you tell them in advance.
Absolutely. I think it's important for women to understand that every breast is different. You know, when your plastic surgeon examines your breast, a lot of the longevity of your outcome will also depend on the quality of your skin envelope. You know, some women have stretch marks, other women don't. Some women are in their 20s and have a droopy breast. Some women in their 60s don't have a droopy breast. So all these things will influence the longevity of the cosmetic outcome of your breast augmentation. And so some of the things that women may expect in the future or in the long term, in terms of cosmetic outcome, is that things will change, most likely. For example, if there is weight gain, if there is pregnancy after breast augmentation, or just simply aging, your breast will change, and that may include that your breast tissue in front of the implant might drop a little bit, which can cause what some surgeons refer to as a Snoopy deformity, and I'm sure you understand the analogy, where the breast tissue kind of drops in front of the implant and doesn't, you know, the breast doesn't have such a pleasing shape. Also, there can be some rippling noticeable under the skin, and this is mostly a risk for women who are very slender and have very little breast tissue. And what the rippling is that the implant may have a few folds on its surface, and that can be visible through the skin. Also, the implant over time can bottom out. And it can also cause what we refer to as a double bubble deformity, where you have, you know, one curve at the bottom of the breast and then another one where the implant has dropped. So these are all things that may occur over time after a breast augmentation, and that may prompt women to have a revision surgery. And I think it's important to know that with breast augmentation, because it's a cosmetic operation, the revision surgeries, even if it's for a rupture or a capsular contracture, may be at your own cost, depending on where you live, depending on the type of insurance you have for your health care. And so these are all things that have to be factored in early, you know, at the time when you're trying to make the decision to have the surgery or not. And I think another topic that we will dedicate a video on that is also now more discussed about breast implants is the breast implant associated ALCL, the anaplastic large cell lymphoma, which has been associated with breast implants. This is a pretty important topic, and I think in the future we will soon make a video to address this very specific topic.
And so I guess when you hear things like that, some women worry. They might want bigger breasts, but they don't necessarily want to have an implant or a foreign body in their body. Is there an option for breast augmentation for them?
Yes. Indeed, there actually is an option, which is to do breast augmentation with fat. When we transfer fat to the breast, essentially what the procedure entails is that you choose a body part where you have fat that you want to get rid of. So you get liposuction somewhere, and then that fat is transferred to your breast. So for example, women may often choose the stomach or the thighs or the back.
It's a win-win procedure.
Exactly, right? So so the fat is then injected in the breast. So I think there are certainly advantages to having fat transfer breast augmentation, and which is what you pointed out. It's really appealing to know that you are using your own tissue and that you are not having a foreign body placed in your breast. I think it's also important for women to know that when fat is transferred in the breast, of course, there are possible risks and complications. Yes. And so when the fat is transferred, it will cause scar in your breast. If, for example, too much fat is transferred at once, some of the fat will die. So we call this fat necrosis. And fat necrosis can present itself as a hard lump. And so, of course, the bell rings, oh my God, do I have breast cancer? Or it can present as a lipid cyst where the fat dies, and in the process of dying, it liquefies and forms a little fluid collection inside of your breast. And so these are all things that can be really stressful for patients because, you wonder, do I have breast cancer? I have this lump in my breast. And it can generate, breast biopsies, more imaging, and concerns like that. So I think that, for example, when you go, so let's say you have had fat transfer breast augmentation, it's very important when you go for your screening mammogram that you tell the radiologist that you have had fat transfer, and you want to find a radiologist who is used to looking at fat transfer in the breast, because they will have a better eye to differentiate scar or consequences of fat grafting versus breast cancer.
Yeah. Well, at least make them aware.
Absolutely.
Usually whenever sometimes you do have a questionnaire when the technician sees you, they will ask you, do you have implants? Have you had surgery to your breast? And all of those things are quite important because they will be taken into account when they look at your mammogram.
And same, as you mentioned, for breast implants, it's really important to let them know that you have breast implants at the time of your mammogram, because they will have to modify the way the mammogram is performed to get different angles to make sure that all your breast is really visible, to give you the best assessment possible.
I hope that you guys really enjoyed this video. If you do have questions on capsular contracture, breast augmentation, possible complications, or even want to know more about fat grafting, please let us know. Leave it in the comments down in the box below. We will tally all of your requests and try to make the videos that you want to know more about
as soon as possible.
Breast surgeon.